Hi guys, you're welcome to my channel. This is Caroline. If you're new here and you're a first timer, please remember to click on the subscription button. Yes, um, as you can see, I am in the hospital. I'm in the hospital, as you can see, and this is my little baby. So basically, I was operated a few days ago, 4 days ago, and my baby was just had just clocked 8 months. But then I happened to have a situation, and this situation is called preeclampsia. So preeclampsia is a kind of a disorder that is got among pregnant women, and this always, according to the doctors, it always starts um, from week, most likely halfway of the pregnancy. That's when this happens. But also it's very hard for the doctors for the medical personnel to find out that someone has got this kind of a situation. And so it happens from when you're, some people when they are 20 weeks pregnant, or let me say from when you're 20 weeks. It might happen when you're 25, 27, you know. And then but mine happened when they discovered it when I'm week 35 pregnant. And it can also happen 6 weeks after you've given birth. So, and how do you get to know that you have preeclampsia? You get swollen hands, you get swollen face, swollen feet, and not only that, your blood pressure will go high. And then when they make your test, the urine test will always be having what they call protein. So I happen to have these swellings, I think 3 days before I went to see my doctor. And when I told them about this, they were like, okay, come to the hospital. And when I got there, and they happened to find that my blood pressure was very high, and I also had protein sample in my urine sample, proteins in my urine sample. So, and then they started to make further investigations, things like that. I just went as a normal checkup, but I did not know that it was going to turn out to be an operation for me. So my high blood pressure was extremely high. It caught me by surprise. And the other thing is that this kind of a situation affects the eyes, affects the brains. When you begin, especially when you're pregnant, and then you begin to be like you have a blurred, you don't see well. It's like you're seeing darkness at sometimes, and then you just know, like a blurred vision. Then you just know that there's something wrong. And it also causes damage to the kidney, it causes damage to the liver, yeah, things like that, and the brain. So it was a serious situation, not like I thought, And then the other thing, it can also lead to brain stroke. it can lead to placenta, abruption. So there were so many things, and I think I was a little bit even more scared when I got to digest all this information at at this moment when I got to know the danger of what was upon me at that time. And uh, it also has other risk factors like hypertension, diabetes, obesity, and maybe family history. So, and the immediate treatment for this is to make sure that you deliver. That fetus has to get delivered. The placenta or the fetus has to be delivered, and that was the only option they gave me. The only option was to go under a C-section, um, to get rid of this situation at that moment. So it was not really a very easy decision to make in a blink of an eye for me, to get to just believe myself that I was going to undergo this, um, you know, surgery, because the first two children I pushed them so well, there was no problem, except that I realized that I got blood pressure with my first daughter on the day I was going to give birth. So I think this started earlier on from my first pregnancy, but it happened in a different style. That it was at the time when I was on labor pain, and yeah, they didn't take it serious in the country I was at that moment, but I still managed to push normally. So preeclampsia is not a very good situation, but this only happens in pregnant women. So when you're pregnant, you have to really be very, very cautious, very, very careful to know what kind of a status your blood pressure is in, or monitor your body and know. If I was not very keen of myself, I think it would have turned out to be very, very late for me to control some of those permanent situations like, stroke, and then, some other danger situations. So, yes, that is in brief. And yes, that's all I can say. And also, I got to know that when you have severe preeclampsia and then you happen to get seizures, seizures, are they called seizures? Then it will lead to eclampsia, and then that is the worst situation. But I thank God that all went well with the operation. My baby is doing okay. I'm doing fine. We are healing. That is the most important thing. So thank you guys. If it's your first time, please remember to click on the like the video, share it with your friends, and subscribe. Have a nice day.